Welcome to DairyPod, a podcast series from Dairy Australia. Featuring a range of experts, each episode offers insights into Australia's unique dairy farming conditions, as well as personal experiences and the latest in dairy innovation.
So, Mac, thanks so much for agreeing to come on DairyPod today. I might start by just asking you to tell the listeners a little bit about yourself.
Thank you, Stephanie. My name is Mac Kneipp, and I'm a mixed veterinary surgeon with a practice with my wife, Kathy, in Gundawindi, Queensland, just on the border of New South Wales and Queensland. I graduated from the University of Queensland a long time ago. We had our 40-year reunion the other day, and I've been basically a mixed vet ever since. Opened my own practice 35 years ago, 35 years ago. And but I've also had, I've kept up my interest in academia whilst I'm a mixed animal rural vet. And so I've studied, I did a membership in pharmacology, veterinary pharmacology, and then I did a master's in small animal medicine, and I've done a PhD in Pinkeye. And ophthalmology is something I've always been interested in.
So ophthalmology really being the study of eyes, and it sounds like you're interested in ophthalmology of all different species. But Mac, what made you decide to do a PhD on Pinkeye in cattle?
Well, I think for a start, things hadn't changed. You know, I grew up also on a mixed property, a sheep and cattle property, and Pinkeye was a horrible thing we'd see, and blight in the sheep, but Pinkeye in the cattle, they'd call it, and it was horrible all those years ago when I was a kid, and I just didn't think that things had improved, so that sort of piqued my interest. I didn't think, despite all the treatments we had, everything seemed to be exactly the same. Nothing's changed at all. And furthermore, I found that Pinkeye disease broke a lot of the rules of ophthalmology, so it just didn't make sense, and so that really started me.
How long did you spend studying Pinkeye?
Well, the PhD took me about 5 years, I think. I did it full time, but I kept working, but not meant to know that. I probably had been interested in about, I certainly had always collected data on it, et cetera, and been quite interested. Like one thing I noticed was, for example, that here in a beef area, that we would have appearance of outbreaks of pinkeye on the farms, but when they put them into a feedlot right near them or on the same property, the pinkeye would disappear. So the idea that it's a contagious disease and it spreads animal to animal when they're put in close together with flies and et cetera, just didn't make sense. I hardly ever sell any pinkeye treatments to feedlots. That was a major one. What the heck? And if you do sell any or Benin, like the cloxacillin ointments or something to feedlots, you find they're using it in their horses. So once you're in a feedlot, the pinkeye disappears. Now, that didn't make sense to me, and there's plenty of other things too, but yeah.
So, Mac, I think you've really just piqued my interest in what you said there. So you said that, you just observed anecdotally that you didn't see much pinkeye in feedlots, and the same animals could be really challenged with pinkeye when they were on farm, sort of before they entered the feedlots. Can you tell me, Mac, what were the big findings in your PhD? Actually, maybe go back a step. First of all, what did you set out to discover, and what did you discover?
Well, I wanted to, Stephanie, originally I wanted to work out the risk factors for pinkeye, I started with how much pinkeye is costing and what sort of impact it has on farms. So I worked out how much pinkeye ointment is sold in Australia because it's an S4 drug and it has to go through vets. And so I worked out how much of that was sold in a year, and if it was used mostly in cattle, and we did some mathematics on it, et cetera, and modelling, then how much it's affecting cattle in Australia. And, we found that there's $10 million worth of sales a year, and, it makes it affecting a large proportion of the herd. So that was showing impact. I actually did a bit of other study too and tried to work out the impact globally, but that was a bit harder. And we did work out what we thought was the prevalence, but we couldn't really work out the impact. So that was with a fellow in Nebraska. But then I did a survey of farmers because I wanted to know what their response, what they thought about pinkeye. And there was a very good study done a long time ago in Australia that everyone still refers to. and it was done in the late 70s and published in 1982 by Slatter et al. And Slatter was one of the pioneer ophthalmologists of the world. He really was Australian who went overseas and did all sorts of things. But he wrote Veterinary Ophthalmology. There's still the best ophthalmology book in my opinion. So he wrote that. And his first subject he did all those years ago in WA, he was a Queensland graduate, WA, he did Pinkeye. So I wanted to try and emulate his study, copy some of it and see if it was still the same. So I actually, went back to his survey that he'd done at that time and worked out the risk factors, etc. So I did the same sort of survey and I got a little bit more than he did. I got 1,600 responses, over 1,600, and then we could do modelling, etc., to say what are the risk factors of what's it costing farmers, and so on and so forth. So that was that bit, and that was really good. That gave me publications. Probably could have closed my PhD down there, but I really like going out in the paddock because that's what I do, and so I decided I'd try to do a trial on treatments in the paddock with paddock pinkeye. So I trialled patches versus injections of oxytetracycline, that's intramuscular, versus subconjunctival injections of penicillin dex, which a lot of vets use up under the upper eyelid, versus ointments, the pinkeye ointments, and versus doing nothing, or sometimes doing all if they were really falling apart. So that trial took me 2 years of my life. It was really hard work in the drought and dust and COVID, and because I lived right on the border and they closed half my sites and all that sort of thing. But anyway, and that trial's never actually got published as such, other than in my PhD, because it just had, I got so much data, it was ridiculous, and we just couldn't. I've broken several statisticians. They try and throw their hands in the air, but I'm personally, I look at the thing and I know anecdotally what I saw and what worked and didn't. And then I also did a 2-year randomised controlled trial of the pinkeye vaccine that's available in Australia. And so, I'd done some stuff, the desktop studies at the start. During that process, I reckon that pinkeye was exactly as I suspected, and I shouldn't have gone in there with bias, obviously, Stephanie, but I did. It wasn't a real disease. I mean, it's not one thing. It's a lot of different things. Every farm that I turn up to and had a look at what was going on, they would improve afterwards. And I'm not saying that's because I'm Mr. Wonderful. I was just an average vet. And I look, mate, that's it. When I did the treatment trial, this was an interesting one. I had this guy and I went preg testing his cows, and I said, "Oh, you've got a heap of pinkeye over there," and he had a heap. I mean, I talk 130 cattle were affected, so I could see them. I could see them in the yards, all middling round and circling and being horrible. And anyway, I said, "Look, I'll come back and do a treatment trial on that if you like." And he said, how much is it going to cost? And I said, nothing. So, of course, he was very happy to have me come back because he'd been struggling with it for a long time, and he couldn't get on top of it. And I mean, I say a long time, at least 6 months. So anyway, he was a hay merchant. He had no end of hay, and he was feeding these animals in quite a closed area, and often put them out on the stock route, etc. So they were used to traumatic feed. I came in, on the second occasion, I was treating and I'm going to come back each week and collect data. On the second occasion, I just let slip like I tend to, talk too much, and I let slip. He said to me, "What do you reckon going on here, Mac?" And I said, "Oh, it's obviously a hay." Well, when I came back, when I came back a week later, so on the first trip, then a week later, and then a week later, I came back he'd changed the hay feeders and he'd changed the hay to softer, less traumatic hay. And by the fourth, there was no point coming back after that because it all stopped. Now, that wrecked my treatment trial.
Well, yeah, so that's really disappointing for your trial, but I'm really interested to hear about what this particular farmer, how was he feeding his hay? What type of hay was it, Mac? And then what did he do differently?
Well, when I see those ring feeders and that, Stephanie, in the paddocks, and I see little calves looking up,
which is pretty much every dairy farm in Australia, yep.
Yeah, they're pinkeye factories. They look up, the stuff falls in their eyes. They don't have fingers like us to pull that stuff out of their eyes. It gets stuck there. It goes, they blink, blink, blink. They weep, weep, weep. The flies turn up, everything else. They throw their head around. Next thing you know, they've done more trauma, or they weren't able to get that seed out. Now, these traumatic things I'm talking about too, they're not always hard. You think if you got a little soft seed in your eye, try to get it out. It can be very soft, but once it's stuck and you're blinking it up and down, of course it will scratch your cornea. You've got to wash it out. And if you can't wash it out or get it out, then it will cause damage. And if that damage goes on for long enough, they'll get a secondary infection. And it doesn't matter whether it's, the magic thing is meant to be that all pink eye is caused by this magic bug called Moraxella bovis. Well, I'm sorry, that's absolute rubbish. Moraxella bovis is a commensal of the eye. In other words, it's part of your microbiome, part of the bugs that live around your eye. It used to be thought that eyes and lungs and, places like that were sterile. They are not. They are full of bugs. And so the Moraxella are one of the most common species found in and around your eyes. So finding a new one and go, oh my, this time it's this one. No, that's rubbish. It's absolute. There are no primary pathogens, that is bugs, that can get through the cornea without trauma in any other species on Earth. So how come cows are the exception? Because we don't pretend that it's an infectious, contagious disease in sheep or horses or dogs or cats or anything else. Stephanie, so as an aside here, I often say to people, I think, being a mixed bear, if Cavalier King Charles Spaniels with their poppy eyes and they all end up with bad eyes, if they all came in as a herd, you'd be sure it was a contagious outbreak.
Yeah.
But they don't. They come in individually, and then we look at them individually. So when cattle, they go, well, it looks like an outbreak. Yeah, but you just fed all that stuff. They looked up. They all got poked in the eyes. You said to me before, we're heading up to the risk factor period, November, October, November for your area. Oh, duh. There's long grass. There's things that are going to traumatise these young. Oh, why do young get it more than old? Well, young have basically softer corneas. They're developing an immune system. So here's their soft little eyes looking up, UV light striking them, or, poking around under mum's udder and getting a burr in there or whatever they're doing, not in the case of your dairy cows, I guess. But, they're out there, they're poking around and they're poking their eyes. And there's probably places where we don't know where that trauma is. And the trauma can be, it can be microscopic. It doesn't have to be macroscopic. It doesn't have to be something you see. When I went and did my trials, I was staining those eyes as if they were a dog or a horse that you do, and I saw all sorts of trauma. Constant. When they do trials over in places like America, they exclude those animals from their vaccine trial, for example, because they can see, did the vaccine work or not? Afterwards, they stain the eye, and the animal's got pink eye, exactly the same pink eye as the animal. But when you stain it, you find it's a linear scratch or a stellate thing, and they'll exclude them. No, that's not Moraxella. Moraxella has to be a circular shape. I mean, real. And again, I could just I know I rabbit on about this, but Moraxella can't even melt a cornea. It has no coagulase. This is a thing that most bugs that melt corneas and get in have to have. It hasn't got coagulase. So how does it cause a melting ulcer? It can't. So
Zach, I'm really keen to explore this further, because as you're talking, I'm thinking about what is happening to all the dairy calves pretty much right across Australia come October, November, December max. So very big chunk of spring calving herds right across this, south of Australia. So we've got sort of 5-6 month old calves. The grass is getting long as we go from late spring into summer. So we've got longer grass, typically that it's starting to go reproductive. So it's starting to, get more fibre in it, and it's spiky. And because that feed quality is sort of tapering off, we're starting to chuck in supplements. So, whether it's feeding pellets, but mostly it'll be feeding hay, probably in the hay rings that you described. So, Mac, if we were to think about, and look, I'm going to toss a couple of ideas at you, and I want you to tell me what you think. If we were to aim to keep those dairy calves on shorter, higher quality pasture, so it's less fibrous and less good height for poking eyes, so we want to maintain that pasture quality. And if we do need to supplement them with something, rather than using hay feeders, maybe we could use like our feed out wagons and potentially run it along the fence line and use something softer like a silage or something, rather than a grass hay or a cereal hay. Are they the sorts of things that you're thinking could potentially work for dairy farmers in reducing some of that trauma that the calves' eyes might be exposed to?
Absolutely. So, there's been plenty of, it's well known in some parts of like America where they don't have traumatic grass, right? It's not that traumatic compared to ours, you'd think, although you'd obviously have less traumatic grass than we do. Sometimes for us, it's so obvious here, it's a joke, like they're on the stock route, poking their heads under, prickly acacia or something, trying to get the last bit of grass there. And you will actually find the seeds in their eyes, or you'll find a poke, and like I said. But if it's been found in America and that if they mow the grass, they don't get it. And I've done that in Australia too, in Corindai. I got the farmer who was having a massive outbreak and called me down there to see. And I went, yeah, I know what's going on here. And I got him to mow the paspalum, and the thing stopped overnight.
Yeah, wow.
So it's also like there's long grass, UV light, all that sort of stuff. Maybe there are some supplement problems with, say, low vitamin A, because you get your vitamin A as a calf out of your mum's milk. And if your mums are not high in vitamin A, then you run out rapidly. They can go on for another year or so. So it depends on how much they've got. Then you've got to have accumulated your own vitamin A. Probably not a problem in your area because you've got green grass. In vitamin A, there's no end of it in green grass, so you don't need to supplement that if you have green grass. But sometimes in our area, we find it dries off. Now, that's very anecdotal. There's no studies have been able to prove it. But funny enough, dry eye in cattle actually does, vitamin A deficiency cattle does the opposite to dry eye in most other species. It actually makes them weep. So it makes them, that's their way of dealing with a vitamin A deficiency, and therefore they're more prone to getting it. But, again, Steph, if you look at the risk factors again, just to prove how risk factors, if the risk factors are all that we thought they were, for example, high UV, dust, wind, extreme weather conditions, drought, blah, blah, blah. Well, why the heck do we get less in the north of Australia and more in the south? Pinkeye is much more common in southern Australia. Well, I tell you the biggest risk factor. The biggest risk factor is quite simple: pop-eyed breeds.
Yeah, and to be honest, Mac, I think we'll struggle to get our dairy farmers milking some of the Bos Indicus dairy breeds. But
Zebus, come on.
It sounds like, we know we've got these high-risk breeds. Jerseys are the most pop-eyed breed that you can possibly come across. We've got very highly susceptible animals in Jersey and Holstein. So we know that we've got cows that are really predisposed to that eye damage. So it really sounds like, Mac, that the biggest risk factor is pop eyes. We can't do a whole lot about that at the moment, although I am pushing very hard to get some research done on potentially breeding for resistance to pink eye. Maybe it's about breeding for better eye conformation in Holsteins and Jerseys and other breeds. But it seems to come back to those things that cause the eye damage, does it? Or talk to me about flies and wind and those things. How much of a role do they play?
Well, the trouble with that is that's very, very difficult to study. And, you can have opinions of people, which I got, and, they think certain things that we notice at a certain time of year and blah, blah. But as I said before, because they run in herds, it's a bit difficult to know why one individual gets it and another doesn't. But definitely the Popeye thing, Jersey's been noted way back in the 1920s as being one of the most common breeds to get it. And we have sort of, if you watch what's happened to the shape of our cattle's faces, they certainly have got Popeye. And the introduction of Angus right through, Angus and Hereford are the two most likely to get it in the beef breeds. And them being introduced and moving further north is now allowing them to have much more pink eye than they previously did. And Cavalier, King Charles Spaniel, Boxer dogs, I'm not surprised when there's a thing called the Boxer ulcer. Why is that? Because their eyes pop out of their head. And the extreme, like the cornea, the bit that gets damaged in these pink eye things, the clear bit we're looking through, it sits like a cap on an egg. So your globe is egg-shaped and a cow's globe is egg-shaped, and then you got this cap. I got in and took some really good photos of this, and it's ridiculously bulgy. So you shouldn't be surprised. You can have troubles where even the lids don't almost come over it. So they're not closing down. And, of course, all things like the tear film and that will break up at the edges because the tear film's very, very important. And when it gets broken down for whatever reason, then you're in trouble. Now, way back when other risk factors like UV light, that's less well proven. There was a big rush on that in the 70s, and they were all sure it was. And then there was quite a big outbreak in Canada, and it was during winter. So, of course, some bright boffin said, it was the reflections of the snow. But then an outbreak in sheds, and I went, what the heck? It's not the reflection off snow. But that reflection off snow thing still exists. People still talk about it. I think, seriously. It was rubbish. But anyway, it's still out there, and people say, it's a reflection off snow. Really. So I don't say that I know all the risk factors, but it's certainly the shape of the face is the main thing. And when you start to do genetic studies on it, it's basically genetics of physiology, the shape of the head. It's not really one breed more resistant to the other. It's really what their eyes are doing.
Yeah.
So, we do that in individuals. When we see a dog or a horse or whatever with an eye, we go, that animal has bad eye health because its shape, its lid is scratching it, whatever. Entropion, for example, does occur in cattle. This is a rolled-in eyelid, and, it's not near as common, but in sheep, it's really, really common. So common, you got this little stapler thing, you just staple their eyelids back, and that fixes them.
Yeah.
So, but that's because they put that in as a certain breed, and then they get rolled in eyelids, and you go around and staple the things, and they get fixed up. But the thing about what I go back to is, for some strange reason, I've worked out the reason because I'm a big fan of history, that since 1885, they have always chased bugs. There's been bug chasers. Oh, no, it's Moraxella bovine. No, it's Moraxella bovoculi. And they will make a vaccine for Moraxella bovoculi without ever having proven it can cause the disease. It can't cause the disease. They've tried really hard to make it cause the disease. They've been scratched their eyes. When they do trials to make pink eye, there's two techniques you do to make pink eye in a laboratory. First of all, you get one of these bugs in a very concentrated soup and make sure it's got all the nasty things that you can think of in it. And then you put it on a damaged cornea. So you either damage the eye, the cornea, by doing the scarification technique, which is much favoured in places like Iowa and Michigan, where you use a wire and you scratch it. Put locally so they don't feel it, but you scratch it across and you hatch the thing, and then you put the super bug and you watch it. Oh, look at that, it caused it, really. And I say to them, well, hang on, did you try any other bugs? Make a soup of anything. I'll bet you, go and get some sewer water and stick it in there. I'll bet you it'll get a secondary ulcer. But, and the other way to do it, which is done in California, etc., is to actually put a UV lamp very close to the eye and put it on for a certain number of, it's all written in literature how to do it, this method, this model, and you burn their eyes with UV lamps. So it's damaged, and then you put the super stuff on. You go, it caused it.
Yeah. So
it's all damage. Without damage, nothing.
Right. So, Mac, if I'm a farmer listening to this podcast, and I think last year I got absolutely smashed with pink eye, or I've been smashed for several years in a row, what's the first thing that you are telling that farmer? What do you want them to go out and have a look at in their paddock or think about?
Well, if it's already happening, it's old, Stephanie. Farmers don't notice it until there's blood vessels. So it takes, the normal way a cornea heals is it slides over the outside layers, the epithelium, like skin. It slides it over and you don't even notice anything happens. So we are constantly having damaged corneas, and cattle are constantly having damaged corneas, and they just slide. The little edges just slide. If it's too big, it's too deep, or it's contaminated, or it's infected with something, then it can no longer slide. Then the body needs to do a secondary thing, which is let's get some blood vessels in there and deliver the things to fix this. So, because corneas don't have blood vessels, so which beggars the belief, how do you actually deliver the vaccine because there's no blood vessels? But anyway, so once they got the blood vessels, they can fix up those deeper things. But the blood vessels don't start for at least 3 days to appear, and they grow 1 millimetre a day from the edges of the clear cornea, from the sclera they come through. And so a farmer who calls me out and I see there's blood vessels and they're 4 millimetres long, I go, that happened a week ago. I said, no, we saw it yesterday.
Thinking about what happened a week ago. Yeah.
Yes, and it also tells you where it came from, the direction, because it's got, it always goes towards the injury. So if there's an old scar up high and it's got no blood vessels, forget about it. Now, that process of putting blood vessels in and then they slowly go out, they're called ghosting, they disappear. It's a normal process we know all about in a lot of species, but in cattle somehow we dismiss them. We go, oh, pink eye. You know what I mean? It's the normal process a cow does when they have a moderate to severe corneal injury. That's what happens. It's not.
Yeah.
So the original guy Billings was taking photos in 1885, like he actually drew it. And they look exactly like they do. It's in the Nebraska University Library, and I've looked at them. It's exactly the same today. If I saw it now, I'd say, oh, yeah, that's Pinkeye. You know what I mean? But it's not pathognomonic. In other words, it's not only for that disease. Anything will do that if it's good enough damage.
Yeah, right.
The farmers call me out and they go, oh, look, it's just happening now. And I go, no, it's been on for at least 2 weeks. And, you know, when the farmers call you out to see the couple cattle that they're worried about, and I went to all these trials, right, so I do have a fair bit of experience in this, you know, I'd turn up and I wanted to do vaccine trials on cattle that were unaffected with pink eye just prior to the season, because the label says do it 6 weeks before an anticipated outbreak. How the heck do you know that? Anyway, so I thought, yeah, right, I'll do that. And every farmer I went to already had pink eye.
Yeah,
everyone. You know, so it's there, it's smouldering away. When you get trauma together because they live in a herd, it all appears, oh, there it is. So back to your question, sorry. First thing I'd say, do not waste your money on vaccine. I know that makes me sound like an anti-vaxxer, but I did a 2-year trial in Australia, and I was part of a trial in Iowa. They do not work. And if you look back to the 1960s, they never have worked, yet people sell them. And if you know how the immunity of the eye works and how making an immunity by vaccination works, and it can't possibly work. So there's evidence it's never worked, plenty of it, yet people keep doing more and more. It's rubbish. Don't do it. So that's it. Don't waste it. So then the basic treatment thing is the more treatment you do, the better, and the longer acting the treatment, the better. So I found the single best treatment for pink eye in my trial, whether it be like in the mild level ones, we scored them. In the mild pink eye cases, everything worked. In the moderate ones, the best one was patches, then followed by injections of a long-acting antibiotic, followed by the subconjunctival injection, penicillin with dexamethasone, followed by the orbenin ointment, very close together, those three, the middle ones. So patches out the front, those three in the middle, and doing nothing was a disaster in moderate ones. And in severe ones, nothing worked except patches or a combination of the treatments. But when I go to see an animal with a bad eye, I don't restrict myself to one treatment. And I found a lot of trouble with that in the trial because I had to do it randomised and control, like blinded, so I didn't know which ones I'd treated different ways. And I just, after a while, I said, I cannot keep doing this in good conscience and watch calves go blind. So I said, I'm going to do a treatment. If I turn up and I think they're at risk of losing the eye or losing their sight, I'm going to give them what I call the kitchen sink treatment, which is everything, which is what vets normally do. So I would treat them with ointment. I'd treat their other unaffected eye with a little bit of ointment. You don't need much. And then I would inject them subconjunctivally. Some of them I'd give intramuscular injections, and I'd put a patch on the worst eye. And they were the only ones that recovered in the severe. The only difference is if we used a combination with a patch. Yep. So, you know, and patches can be fitted incorrectly. But again, it goes back to, if you think of the treatment when you're treating, that you're trying to treat a traumatic eye condition, the idea that you give it one ointment and never see it again. You know, as I did one trial where and my wife wasn't very happy with this because she had to get up every hour right through the night, and collect the tears. So we gave the cloxacillin ointment, pink eye ointment treatment into one eye, and I injected the other one in the subconjunctival of a calf with pink eye, and I took levels of the tear and I froze it, stuck it in an AI canister straight away every hour for the next 36 hours. We can only detect the cloxacillin, the eye ointment drug, for the first 4.8 hours, I think it was. Now, if you double that, it can work no longer than 10 hours. It worked somewhere between 10, but it was only a pilot trial, one calf. And, of course, I didn't get funded to do another trial. That doesn't seem the big sales. So, you know, the more you treat, the better off. That's what I meant. And the longer acting. If you think about the treatments I said, what's the longest acting? Well, if it stays on a patch, what's the next longest? An injection of a long-acting oxytetracycline will last 3 to 5 days. What's the subconjunctival injection may last 3 to 5 days. Orbenin, I reckon it lasts about half a day. And doing nothing, it was horrible.
Yeah, and it sounds like, Matt, like oftentimes we're only wanting to get these calves in once if we can. So if we're going to get them in, put a patch on, give them a long-acting injection, and potentially if you have got your vet coming out to treat them, it sounds like a subconjunctival injection if you can. And Mac, often we hear about these cases that, you'll get a few and then a few more appear and things like that. I know I keep coming back to these preventatives because that's where I really reckon the money is. We really can't start treating cases of pinkeye without taking a really good hard look at where those calves are, right? How are we feeding them? What's the grass that they're on? And you mentioned briefly around mowing, pasture management and pasture quality management is dairy farmers' bread and butter. We try and do grazing management so we don't have to mow it, but most dairy farmers have got mowers and they'll top the grass to maintain quality. And it sounds like that's a really good kind of proactive solution for calves if we don't have somewhere with good quality feed, is just to top it, just to reduce that risk, and just being really mindful of what the ideal height is to poke those calves in the eye. Mac, fly control, is that worth doing?
So it's really hard to say that one again, Steph, because the fly fellas got really excited in the 80s and, gee, they did some great studies. But I read one study, this one was actually the late 70s, and I loved it because he decided he put calves with their notobiotic calves, in other words, calves with no disease, so they're born by cesarean and don't get, put them in an incubator or whatever they do. So anyway, he's calves this thing. Yeah. And so he's got a couple of these. When you're allowed to do it in those days, it's pretty horrible if you read those studies now. Some of them were terrible, because when they finished, they took the eye out, you know what I mean? Anyway, he put all these flies. See, in America, it's the horn fly that causes the trouble as far as they're concerned, or the Musca autumnalis. So and they all say that fly causes it in Australia, but we don't even have Musca autumnalis. So it's really a bit of a nonsense. But they did various things where they infected flies, let them walk over Petri dishes full of bugs, and then let them fly onto the cattle. But part of this was they couldn't get them to land on the cattle, and certainly couldn't get them near their eyes. So one of his conclusions was, you just can't train a fly. So eventually what he did was put these little goggle things on that kept the flies right next to the eyes. And then without any infection, he could do damage to the eyes. So some of those, I'm going to think the Musca autumnalis is not the horn fly. I'm just trying to struggle to think what that name of that bug is. But, it has the females have little sharp teeth, and they can by themselves create pink eye. That's well known.
Yeah.
So when I tell the Americans that Musca autumnalis was first introduced in 1956, came through Nova Scotia, they're very surprised. They go, oh, what, really? I thought it was been here all the time. But it's not down south. So it came through from Europe. In Australia, we have probably flies that they've never been tested in Australia realistically. Can they do the damage or not? But it's funny that buffalo fly up north, they rip their skin apart, as you know, and yet we have less pink eye.
Yeah.
So, I think it's a good idea to do fly control. And often fly control has been, there was one study in America in the 80s that showed that fly control was actually the single best thing you could do. So I reckon that it certainly does help when we've got really high fly burdens. I wonder if it's just the flies, or is it the damage because they're annoyed by the flies and they throw their heads around?
Scratching.
They're just trying to get away. They flick, they carry on, and does that allow them to do more trauma? So is there other things? I don't think the flies pick up a contagion and spread it from one animal to another. There was a guy that I think he actually tied jerseys together, Canman, in 1920 in America. I don't know, it was in South Africa. He tied cattle head to head with one without pink eye and one with it, and he still couldn't get the spread.
Yeah, right.
So this idea, and again, go back to the contagious thing. I just want to keep knocking that on the head because, why are they getting one eye and not the other? I mean, if it's contagious and it's so close, what the heck wouldn't it go to the other eye? Barely get more unilateral than, in other words, one eye than two eyes affected. So if you can toss out that contagious thing and then start to say, right, what's really going on here, you can start to make logical approaches to this, which is traumatic eye conditions. Stop calling it pink eye and say, oh, we've had some damage to the eye, and then you won't have to chase specific antibiotics. In fact, I'm pretty sure if you put a lubricating thing in your animal's eye that will work well, it will work. I think, people have found over the years, you get all these online ones where they've used salt, et cetera, et cetera. I got asked last week, what about kerosene? You get asked kerosene all the time, and farmers do use it. It's still, in my things, it's still used. The trouble with the kerosene is it will certainly cauterize the eye. But does that mean they're blind? They certainly have a scar. I mean, it's not something we would do now, to other species, and it shouldn't be done to cattle in reality. You should do something that's not going to do any more harm. So kerosene stops it in its thing, but you've got a blind or a scarred eye. And, it causes cicatrix and others scars. So, just hygiene, because I think realistically this is a hygiene issue, and it spills over there from animal to animal. Once you've got really gunky eyes in your herd and everything, then of course there will start to be a spread, but it's not really contagious. It's just hygiene, taking advantage of damage to eyes. You make them nice and clean, you clean them up, then you got a chance. Now, I'd say, fly control, yes, good idea. Just use it judiciously. You don't use it. Putting an ointment in the eye, yeah, good idea, but don't use too much. Just put a little bit. Anything spills out of the eye is wasted. And then you may have to repeat it. Now, I go back to your thing, Stephanie, you said, right, obviously everyone wants to do one treatment. So lo and behold, they discover that this drug, cloxacillin, which is penicillin, and most cells are gram-negative. You know what I'm saying? Why the heck would you pick a gram-positive to treat penicillin to treat a gram-negative bug? It just makes no sense. What actually happened was it went through the dairy farmers. They had, when in the 80s, late 70s, early 80s, intramammary tubes of ointment started to turn up for dry cow or for treating mastitis. And, of course, then the clever farmers said, this might do for an eye, and shoved it in the eye. And it started to work. So there was a group, a fellow in Missouri doing his PhD, Weber in Sales, I think it was Sales doing his PhD. They studied that. They said, well, we've had big outbreaks. Everyone used this stuff. We're going to check it out in Missouri, I think in dairy cows actually. And they discovered that when they got the bug that's meant to cause it, Moraxella, and put it in a petri dish and saw whether the cloxacillin killed it, it didn't. In fact, it was the only bug that survived and grew all over the petri dish. So they then went on and made another thing and said, hey, this Moraxella is pretty hard to grow. So they made a selective media by putting it into their stuff, and then it grew better. And that's the stuff we use more than anything else in Australia. Seriously, it is probably just lubricating the eye. And it's certainly treating any gram-positives that turn up, but they'll be defended and say, oh, Mac, you're wrong. No one does the studies. No one checks it out. How long does it last? Well, someone told us in the 80s that it lasted for 48 hours. Oh, relief. If I would never give your dog or cat or horse something an ointment and say, oh, you'll be right for 48 hours. Yeah. It's not true. Yeah. You've got to treat it often. Now, there's also cases where you don't treat pinkeye. If it's mild and you can't get to it, don't treat it. I'm not saying that. And if it's mild enough and the animal has an immune system that can deal with it, it'll get better itself. So it is self-limiting. And people say that it's self-limiting. Yes, it is. But sometimes if it's really badly damaged, it's like saying a broken leg in a dog is self-limiting. Yeah, it doesn't go on forever. But it mightn't heal the way you want it to. And eyes not treated when they're severe enough may not heal how you want. They may be blind. But if it was a horse, we don't have a blind, we can't have a blind horse. So naturally, we try to treat them and stop it happening. And I'm not saying every cow is worth a horse or whatever, but do you know what I mean? It's the more treatment you do, the better. Or be strategic in your treatments. Less traumatic. Get rid of your ring feeders. You buy cheap ring feeders now, secondhand ring feeders. Because they are so traumatic. Look at them. Go and have a look at them. Video them slow-mo and watch the stuff falling in their eyes. All these things I've done. And, so no traumatic feed if you can help it, particularly for the younger animals. And it's so surprising. Why don't older cows get it? They must be immune. No, they're taller. They're looking down into this hay. They've got, they've got a developed immune system that's allowed to shake it off better, et cetera, et cetera. If you did the same things to older cows as young cows, you get the same outcomes if you actually did it. So
yeah, and I think about it too, Mac. I mean, there's not many lactating dairy cows, at least, that are fed in ring feeders, just because it's not a way to get, these are high performance athletes. It's not a way to get rocket fuel into them. So, now, Mac, I'm really curious. At the beginning of the podcast, you mentioned the study that was done was it in the 70s over in WA? Was it Slattery, I think? And you repeated Slatter, yeah, and you repeated the survey. Did anything change with the risk factors that were occurring back in the 70s versus now?
No, not particularly. Whether it was wet or dry was a bit of a thing. Was it more common in wet seasons versus dry seasons? I think farmers associated wet seasons with flies, therefore that they thought that was worse. And ours, it turned out, I think it was dry the other way around. But no, nothing much had changed at all. It was pretty well the same. More common in Northern Australia, Southern Australia than Northern Australia, more common in certain breeds, etc. If you go back, the breeds have actually changed, but the shape of the head hasn't really. And these were actually the opinions of farmers, by the way. They weren't primary tests. Sure. If they thought flies were part of it, that was how that came out in the survey. I tried to ask the questions in certain ways, and some of the answers didn't line up, if you know what I mean. I tried to trick them out a bit to find out. But no, the risk factors were still what they had been. But, I got a bit disheartened with all that. I did a lot of that modelling, and I could model all sorts of stuff, and you get really, that's fun. You carry on with your maths and everything. But realistically, I didn't think anything was changing in the paddocks, and I was much more interested in my treatment and then my actual observations. And what I did, I saw so many of these eyes over time, Stephanie. I took so many photos. I got, I didn't. I usually had an assistant, but I ran these trials totally by myself. No one came and helped me at all. I did it. I had one person visit from Iowa. That was it, and they just have a look. But I did it over 2 years, and it was massive. I did so many calls, etc. It really was hard work, but. I noticed, like I said, that when I visited the farmers, then they would improve because I was chatting to them. And after 4 weeks, there was no farms that we visited that still had pink eye. Because after I'd done my trial long enough, then I'd say, righto, let's get serious and we'll just treat these things, and we'd fix them. And, these are some people that had had it for years, because they'd say, no, I'd advertise for people with a certain number of blah, 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 I'm going to come and treat your cattle for free, and we'll see how we go. So that was part of what I noticed with the trials, and obviously the vaccine trial. I did 7 herds or something like that, and I did it over 2 years, and nearly all got more pink eye, the ones we vaccinated, the ones we didn't. I didn't know which ones were vaccinated, which weren't, and we did all sorts of numbers, so they couldn't claim, people couldn't claim things like we didn't allow for herd immunity and all that sort of stuff. And I just did it by a flip of a thing. Vaccinate that one, don't vaccinate this one, so on. And yes, it just didn't work. It was wasted. But I actually had so many photos taken during that period. There was over 8,000 photos of pink eye. And not just pink eye, but eyes of the various, scars, et cetera, et cetera. So I started to realise I could score them remotely. So when I had to have a holiday at some stage, I went away, and farmers on those trials would send me a photo. And I started to score them. So then I came over, they can score this. So I took that towards the end of my PhD, when I just couldn't wrestle those figures with the treatment trial. I thought I'll chuck another couple things in, and I'd come up with this eye score that I'd got from other people and then put together and made up my own score. And, acute, chronic and resolved. And then I could take that photo and remotely look at it. And that got funded by the MLA. I sort of moved away from it, was over pink eye, and probably the people were over me. And so I didn't end up completing that myself, although they called me back in at the end. And, it almost became something that an AI thing could do, and it could be in the future. So you take a photo, it'll tell you what to do. But, I tried to trick it out a few times. I took a photo of my niece's eye and it told them to treat. But So
Mac, do you think is there thinking about what the gaps that remain in terms of research, do you think there is scope to do more work around these risk factors? Like, we actually have some first-hand, observations recorded on these farms, a single person going across several farms looking at the grass length and the type of hay and where the hay feeders are used and all that sort of stuff. Is there more work to be done there, do you think, Mac, or is it just about take away that trauma, the things that are damaging and traumatizing the eye, and kind of get on with it? What are your thoughts?
My thoughts are if we approached it like every other species, we wouldn't have this problem. This all started because the first person to look at it, Billings, had just been trained in Koch's laboratory in Berlin, had come back and he was looking for a contagious disease to name after himself, Frank Billings. And he chased the thing till the ends of the earth and everyone else fell in line and said, yep, it's like the emperor's new clothes. So the big problem with this, there's plenty of research to be done, Stephanie, but not into the bacteria. I mean, I've got an article here from Brazil the other day. They found a new one, Moraxella oculi in Brazil, an infectious outbreak. Rubbish. They'll just go on and on and on and on. And there's people get paid for that and they will try another vaccine. They have done massive vaccine trials, including the one I did. And, it didn't work. But, no, you've got to put at the end, but we should do more studies. When did this sort of stuff, why can't you just say, no, it doesn't work? My thing for that is when is enough evidence? You know what I mean? So there is plenty of studies you could do, but you need ophthalmologists or people who know about ophthalmology to do it. And if you did that, if I'm considering I can do a herd score too. And that is tell people when they should start intervening. One pink eye does not make a herd outbreak.
Yeah.
Does 5, does 10, what's the percentage? So I worked out how to score that. But most of the farmers, when they're sending to me, they're scars. It's over. It's going to go its own process and get right now. Stop wasting your Bennet, pink eye women. So I found that in lots of cases they're using it too late. And the damage is only seen if you use things that highlight the damage, and that's things like fluorescein stains that you do with your dog or your horse. And no one does it in cattle. No one uses a blanket over their head. And I put a dark thing over me and the cow. Not much fun under there with a cow belling at you, but, and then I stained the eyes and I used a purple light. Can you imagine what I could see there? And I always use magnification. So if my young vets go out and do not magnify an eye, I say, what the heck did you think you were doing? You've got to be able to see. And the idea that you'll look at it and, that's pink eye. So I reckon a big problem here is we said, it's pink eye, that's over. Don't have to do anything. It's pink eye. Yeah, it's pink eye. No, it's injury to the eye. Can you do something about that and stop that happening? Could you do something about that and treat that individual animal? Yes, you can. Yes, you can. So, then do it. Don't wait. Don't wait till it's too late. Get an idea of what's happening in your herd, because dairy farmers see their cattle all the time. So, they should be able to go and check it. If you start to see a few, if you get in and you're aggressive in the early stages and you treat those that start to affect you, won't move into that hygiene thing where it's just spilling out as muck and gunk into another animal.
Yeah, and just having a look at the paddock where those animals are and just trying to work out where it's coming from. Mac, this, as always, I love chatting to you. Your enthusiasm is absolutely infectious. Excuse the pun, because I know you hate that word. But look, I always learn so much from the conversations that I have with you. And, we did a webinar back probably this time last year, and I got some absolutely amazing feedback from farmers just around how practical you are and how logical and your approach to it. So, Mac, I know the farmers that are listening to the podcast will really appreciate your insights, and I hope that, we can make a difference to some of those farms and we'll see a little bit less pink eye, or hopefully a lot less pink eye this year as a consequence of this podcast than perhaps we have before. So thanks so much, Mac.
Yeah, thank you very much, Stephanie.
Thank you for joining today's Dairy Pod episode. We hope you found it enjoyable and insightful. For more information, check out the episode notes. You can stay up to date by following Dairy Pod on your favourite podcast platform. To get in touch, visit dairyaustralia.com.au. Until next time, take care.